Recently, I got called in to see a child for a snake bite. This little girl was 8 years old. She'd been bitten by a puff adder, and she had been bitten the day prior. And I found out that this 8-year-old little girl with swelling all the way up to her shoulder from this snake bite on her hand, her and her father didn't have money for transport, but they had walked to the hospital from Labofu, which is very, very far away. It's one of the furthest places that we hear about patients coming from.
Movement helps reduce swelling, both elevation and movement.
And I just had one of those moments where I almost started crying because just thinking about how far she had walked.
I think she's humble again.
And just the strength and resilience of the people here, and the fact that there wasn't a closer hospital for her to go to.
There are a lot of challenges in missionary medicine. We practice with limited resources, limited diagnostic capabilities. Sometimes we know the treatment a patient needs and we don't have access to it, but we're taking care of people who have tremendous medical needs and who travel very far to access medical care.
People come to you at their very worst. We're able to show them the love of Christ. We're able to show them that they are worthy of love. Over and over again, Jesus calls us to love, and that's what I want my life to be about.
September, that's when she started having the pain. Yes.
As a young child, I grew up in the church. When I was in high school, I really felt like the Lord was calling me to do mission work with some skill or way to better help the people that I was encountering, and not just in a spiritual way, but also a physical way. That just naturally led me towards medicine.
Move your ankle.
One of the things we love about Christian Health Service Corps is the level of importance that CHSC places on providing high-level quality medical care, on meeting international standards and guidelines, on really trying to provide excellent medical care to the people we serve. They know what it's like to be on the mission field, to work in this kind of setting. They know that every place has its unique challenges and unique ways of doing things.
We're looking at the cava and how it's like distended.
One of the reasons we chose Christian Health Service Corps is because they really support my profession as being my ministry. They strictly work with healthcare professionals and see that as our ministry. I really respect them for making that a priority.
I know there are a lot of young doctors-to-be who go into medical school dreaming of using their professional skills someday to serve people in a place of great need. I would encourage them to hold tight to that calling, to that vision.
Just keep loving people and keep learning from others that are ahead of you on this walk. I feel like we have the opportunity to look at patients and really see them for who they are, who God created them to be. In a really dark place, if we can be that light, that is something that's really exciting to me.